Welcome back, everybody. This is Amanda Ridout, health coach, and once again, here we are with pharmacist, nutritionist, and cosmetic chemist, Ben Fuchs. And today, Ben, we first of all, let me just say we are all really enjoying all these anti-aging tips and the information we're getting on skin health. Not just skin care, but
skin health versus skin care.
Yes, I love that. And I think we were going to talk a little bit about the B-list vitamins. Was
right. Well, not B-list vitamins necessarily. They do tend to be vitamins, actually. But we're talking A-list ingredients, B-list ingredients. No, ingredients, skincare ingredients. As it turns out, vitamins are among the most powerful. They may be the most powerful ingredients. Certainly A and C are on the list. But there's other things that have some power on the skin as well. Specifically minerals. Selenium sometimes has power on the skin. Zinc certainly has power on the skin. There are phytonutrients, plant nutrients, carotenoids, flavonoids that have some sun protection benefits. I did a post today on unsaponifiables. Have you ever heard that term? Unsaponifiables, well, unsaps.
I know that has to do, a soap is considered a
saponifiable, right? Mm-hmm. So an unsaponifiable is an element that doesn't turn into soap, that you can't make foam out of. It's unsaponifiable. You can't make soap out of it. And there's actually something that has been in the news lately called avocado soybean unsaponifiables. Have you heard about these? Dr. Oz has been talking about them, and they're all over the internet as treatments for arthritis. Well, it turns out that unsaponifiable elements, which are found in avocado and soy and shea butter and various fruits and vegetables and botanicals, have really interesting properties, topical properties as well as internal properties. So it's not just vitamins, is the point here, that are on the A list, but vitamins are key. Absolutely, they're key. The skin is receptive to vitamins. The skin eats, in essence. So we talked about A, we talked about C. Those are the A list. You can only bring two nutrients or two ingredients on a desert island with you, A and C. If you can only bring three ingredients, throw in alpha hydroxy acids. But there's a B list. There's a second list, and there's also a C list, which we'll talk about eventually. The B list, these are nutrients, these are ingredients, and they tend to be vitamins, although there's a few others. Probably some of the unsaponifiables would be on the B list, but for the most part, these are vitamins. And they're not as important as A and C, but they're still relevant and they're still functional, and you can still get a lot of benefits from them. And there's a few of them. And we're probably not going to get to talk about all of them because I want to keep these videos a little bit short, but maybe we could do part 1 and part 2.
Absolutely.
So we got vitamin E. Everybody has heard about vitamin E. In fact, there's a lot of mythology around vitamin E. People think they can put vitamin E on a scar, for example, and the scar will go away. I've heard that. That's not true, but vitamin E still has some benefits. Vitamin D is very interesting because we didn't really know how important vitamin D was for the skin and for the health of skin cells in particular until the last 10 or 15 years. But we're starting to understand now that vitamin D has a lot of relevance for skin health. Vitamin K has some relevance for skin health, not in terms of skin cells, but in terms of blood vessels. There is some relevance to vitamin K in terms of skin cells. We'll talk about that here in a second, but most of it involves bruising. Vitamin K's got some wonderful anti-bruising benefits. We'll talk about that. And then niacin, which is one of the B vitamins. There's more and more literature now coming out about the importance of niacin. In fact, there's a really neat new ingredient called it's a combination of vitamin A and niacin. I'm trying to think of what it's called. Retinol nicotinoate. I like saying that. Retinol nicotinoate. Wow. And that's a combination of vitamin A and beta and niacin, vitamin B3, niacin, and vitamin A together. And it's got some really interesting properties. And then pantothenic acid, I've been using that one for a lot of years. That's got some real cool topical benefits too. So let's go over these one by one, okay? Yeah. First of all, the most famous one is vitamin E. Everybody knows about vitamin E, as I say, for scars. But vitamin E's real claim to fame is that it's an antioxidant and it's very sun protective. I always put vitamin E in my sun protection formulas, and that's my favorite way to protect the skin from the sun is not by using octylmethoxycinnamate and octocrylene and oxybenzone and these various sunscreen chemicals, which tend to be very toxic. I like using vitamins in addition to zinc oxide to protect the skin from the sun. And vitamin C we talked about earlier. That's a spectacular sun protective vitamin. But vitamin E has got really interesting sun protective benefits, and it's also got environmental protective benefits. So it will protect your skin from cigarette smoke. You know, cigarette smoke can be very toxic to the skin. Air pollution kinds of particles, those can be toxic to the skin as well. Even chlorine in your water when you wash your face with tap water, that can be very pro-aging. In fact, after you wash your face with tap water, it's probably a good idea to use a little bit of vitamin E, and even a little bit of vitamin C to detoxify the chlorine.
Nobody ever thinks of that.
Right?
Yeah,
isn't that interesting? You wash your face with tap water, and the chlorine tends to stay on your face too, so that's very pro-aging. After you wash your face, that's when you want to use topical vitamin C and topical vitamin E and topical antioxidants to protect yourself. Even fluoride also. Not to mention all the other nasty chemicals that are in tap water. So vitamin E's got it's got environmental protective benefits. It protects you from solar radiation, but it's also got some moisturizing properties as well. Vitamin E can penetrate through that raincoat, that barrier, the stratum corneum barrier, so it has effects in the deeper levels of the skin. And vitamin E comes in different forms. You've got the main form is called tocopherols, and then the other form is called tocotrienols. And this is a more exotic, more powerful antioxidant form of vitamin E. So I like using both tocopherols and tocotrienols. Very few skincare products will use tocotrienols because they're expensive. Tocopherols, on the other hand, are much cheaper. One little interesting tidbit about vitamin E is most vitamin E oil is in soybean oil, and sometimes people can react to the soy and they'll blame the vitamin E, and it'll actually be a reaction to the soy. So if you have a problem with soy, you maybe want to be a little bit careful with vitamin E, because most vitamin E that you get in skincare products, or you get even in nutrition stores, vitamin E capsules, come from soy. So you got to be a little bit careful with your vitamin E. Another fatty vitamin, and you'll notice most of the good nutrients for the skin are fatty. Yeah. It makes sense because the skin's a fatty organ. The second important one is vitamin D. Now, more and more, we've known for a long time that vitamin D is important for psoriasis, for example. It's actually medicine for treating psoriasis, but we're just now starting to understand that vitamin D has a very important role in keeping skin cells dividing correctly. Now, it's been known about in the pharmacy world and the medicinal world, but not so much in the skincare world, that you can keep skin cells dividing at the right pace. So remember, skin cells are growing from the bottom to the top. Yeah. Remember well, let's do our little metaphor. Yeah. We have our beef, our candy coating, and our sprinkles, right? So the candy coating here underneath the sprinkles and on top of the beef, that's called your epidermis. And the cells of this area, this candy coating area, start off at the bottom and then they migrate their way to the top where they become sprinkles. And as they're migrating to the top, they're dumping their contents overboard, and those contents become moisture factors eventually. So keeping skin cells dividing and growing correctly as they move upwards to the top in a stable and organized fashion, number one, it's very tightly regulated, very controlled, and it doesn't take much to throw that off. And number two, there's things we can do topically to keep that happening correctly. And that's one of vitamin D's main roles, is to keep the cells dividing correctly as they're migrating upwards to the top. That's why vitamin D is beneficial for psoriasis, because psoriasis is a defect in this movement. It's caused by a defective movement of cells going to the top. Eczema also is caused by a defective movement in cells growing from the bottom to the top, and vitamin D can be used for improving eczema. And because as the cells are growing upwards from the bottom to the top, they're dumping their contents overboard, and those contents become moisture factors. If you can stabilize the movement of cells from the bottom to the top, which vitamin D does, you'll get more moisture factors, and your skin will stay hydrated and more moisturized. Okay. So vitamin D has multiple benefits. It keeps cells dividing appropriately. So for psoriasis and eczema, it can improve those conditions. And because the contents that are dumped overboard as the cells are migrating, as they're journeying upwards, become moisture factors, vitamin D can be important for moisturizing the skin. And of course, vitamin D also has sun protective properties. So you can get actually environmental protection, sun protection specifically, by using vitamin D. So those are two very important nutrients, vitamin E and vitamin D, in addition to your vitamin A and C. Did you have a question?
Yes, I did. The vitamin E and the vitamin D for sun protection, could people feel confident that if they use these vitamins, it's so much better than if they slathered some kind of sunscreen on?
Oh, please.
Yeah, I know.
Oh, for sun protection?
Protection, yes.
No, not necessarily. You're not going to get the same kind of drug-like benefits. You're really getting a pharmaceutical drug effect when you're using the main one is octamethoxycinnamate. There's other ones. Octocrylene is another one. Avobenzone, oxybenzone. Those are giving you drug benefits. So you're not going to get the same kind of potency with a nutrient. Of course, you're not going to get the toxicity either. So when you get potency, you also get toxicity. So the way I look at it, it's much better to have something that's less potent but isn't going to give you the toxicity. The drug companies and the cosmetic companies, they don't believe that. They think, well, we're going to give you potency, and it's too bad if you get a little toxicity with it. I don't look at it that way. I look at it, you don't want any toxicity, even if you have to sacrifice potency.
Well, and we've talked before about when your body is completely nutrified, all those eventually get to the skin and protect you. I was about to say, that's the real way that you want to protect your skin, is by eating your vegetables, making sure, and fruits, making sure, the peels of fruits, making sure that you have fat absorption, because all of these sun protective nutrients are fatty. The unsaponifiables that we just talked about, the unsaponifiables, one of their main roles is sun protection, and one of the characteristics of unsaponifiables is they're fatty. That's why they're unsaponifiable. Okay. If they were the saponifiables tend to be watery. That's why you can make soap out of them, or suds out. They will suds. Unsaponifiables are fatty, and they require digestive enzymes, pancreatic enzymes, stomach acid. You got to have bile. Your gallbladder has to be working. Your liver has to be working. See what I'm saying? Yeah. Lots of factors have to be working correctly in the digestive tract for these unsaponifiables to get absorbed and utilized so they can get into your skin. And this is a big problem, and it's very underappreciated. And you want to talk about hyperpigmentation. Well, one of the main reasons why we hyperpigment is not only are we not getting these sun protective nutrients from our foods, but even if we're conscious enough to make sure we're eating our vegetables and make sure we're getting these unsaponifiables in our diet and these nutrients in our diet, if we don't have our healthy gallbladder, if our liver is somehow becoming fatty and starting to get weaker, for women, if they have had a hysterectomy or a gallbladder, or they have had their gallbladder removed, all of these are going to compromise their ability to absorb and utilize these sun protective nutrients from their foods. Especially important for older women. And this is one of the reasons why as women get older, they'll hyperpigment, they'll get more photo damage, and they'll blame the sun. Yeah. And their doctors will blame the sun. Yeah. And nobody will think, well, gosh, maybe I'm not absorbing my sun-protecting nutrients from my broccoli and from my cauliflower and from my veggies. Nobody's going to focus on that. Makes so much sense. We looked at 2 of the B-team vitamins that are used topically for skin nutrition or skin health. And what we're going to do is we're going to come back next interview and talk about another 2. So everybody stay tuned, and we'll be back with more information. For now, thank you so much, Ben, for everything that you do for us.
Thank you.
Bye.